For the introduction, in early 2020, the world was shocked by the presence of a devastating virus called coronavirus disease, which is Covid-19. The case, which was initially detected in Wuhan, China, has spread around the world. Many lives has been lost due to this vicious virus. In addition to the presence of new variants that cause an increase in infections and death due to COVID-19. What is coronavirus? Coronavirus are a type of virus that can infect humans and cause respiratory disease. The multiple crown-like spikes on the surface of the virus give it the name corona. Coronaviruses that cause sickness in humans include SARS, Middle East Respiratory Syndrome, which is MERS, and the common cold. COVID-19, a novel coronavirus strain, was initially discovered in Wuhan, China in December 2019. Since then, the virus has spread to every continent except Antarctica. Bats, cats, and camels are all known to carry coronavirus. The virus resides in the animal but do not infect them. Viruses can sometimes spread to the other animal species. As the viruses spread to different species, they may change, which is mutate. The virus can eventually travel between animal species and infect people. The first person infected with COVID-19 in Wuhan, China are likely to have contracted the virus at a food market that sold meat, fish, and live animals. But investigators are still looking into it. Even though experts are unsure how people become infected, they have evidence that the virus can be transmitted straight from person to person through intimate contact. Next is, what is Delta variant? Delta variant is a Delta strain of SARS-CoV-2, which is the virus that causes COVID-19, is a novel strain. It was discovered for the first time in India in late 2020. On January 20, 2020, the first case of COVID-19 was discovered in the United States. On May 31, 2021, the Delta variant was named, and by August 24, 2021, it has spread to over 163 countries. According to the World Health Organization, WHO, Delta variant is becoming the dominant strain worldwide. WHO labeled COVID-19 a public health emergency of international concern by the end of January 2020. What is the country that affected by Delta variant? The variation is likely to have contributed to India's fatal second pandemic wave, which began in February 2021. It eventually caused a third wave in Fiji, the United Kingdom, and South Africa, and the World Health Organization warned in July 2021 that it might happen further in Europe and Africa. It had also caused a spike in daily infection in Asia, the United States, Australia, and New Zealand by the late July. What is the symptom of Delta variant? The symptom of Delta variant are prolonged headache, runny or stuffy nose, sore throat, diarrhea, vomiting, muscle pain, and also fatigue and lethargy. So, if we have the following symptoms or no relative who have these symptoms, then we need to immediately inform the health workers so that this epidemic can be killed and not spread. There are 4 things we need to do to prevent ourselves from being exposed to the more dangerous Delta variant than the already dangerous COVID-19. First is that we need to get vaccinated. COVID-19 vaccination are extremely successful in preventing severe illness, pneumonia, and hospitalization when used against the Delta variant. Even if you have been vaccinated, you might get a moderate case of COVID-19, but it's still better than getting severely sick and needing oxygen or hospitalization. The FDA's approvals of Pfizer's COVID-19 vaccine may assume certain vaccine safety worries, as the entire approvals consider more than 6 months of participant monitoring after more than 170 million people in the United States has been vaccinated against COVID-19, which is 92 million of whom received the Pfizer vaccine. Next is wearing a face mask. Wearing a face mask protect everyone around you, especially if you don't realize you are infected. It will, however, protect you if you are in the presence of someone who is infected, is unaware that they are afflicted, and is at danger of transferring the virus to you. Third, keep a distance when leaving the house to avoid contact between others. And finally, we refrain from going out to meet the community except for important things such as work and so on. For now, we need to assume that ourselves and everyone else are carriers of COVID-19. Together, we keep COVID-19 from spreading, and hopefully we can live in atmosphere before COVID has not happened. In conclusion, we must always be vigilant in doing daily activities so as not to get COVID-19 results. For now, we must refrain from going to places where there are many people and also places that are detected to have high COVID-19 cases. Practice confinement at least 1 meter away from others, wear a face mask when out of the house, and go out when necessary or have only important things. Together, we stop COVID-19 from spreading, especially in Malaysia.